Hi, my name is Louise Fisher and today you'll be watching the video Principles of the Cover Test. The cover test is an objective test which is useful in detecting and diagnosing strabismus. The cover test is a routine examination performed at most clinical appointments. To perform a cover test, an occluder and accommodative target must be used. The test can be performed at near or far, with distance tests using the Snellen chart as an accommodative target. It is necessary to use an accommodative target as this ensures the patient's full deviation is measured in cases of accommodative deviations. The cover test is made up of three components: cover, uncover, and alternate. The cover component involves placing the occluder in front of one eye while watching the movement of the unoccluded eye. This allows us to detect manifest deviations or tropias. On a patient with no deviation, occlusion of either eye will result in no movement to take up fixation, as both eyes are already aligned. Here we see no movement of the left eye when the right eye is covered. We also see there is no movement of the right eye when the left eye is covered. Here we see a patient who has a manifest deviation that can be classified as an esotropia. On cover of the right eye, we see an outward movement of the left eye to take up fixation. When the left eye is covered, the right eye makes no movement as it is already holding fixation. The cover component doesn't allow detection of aphoria as it only detects manifest deviations. In this patient with a latent deviation, there is no movement of the left eye when the right eye is covered. There is also no movement of the right eye when the left eye is covered. The uncover component of the cover test involves covering one eye and observing the movement of that same eye when it is uncovered. This allows us to detect latent deviations or phorias. On a patient who is orthophoric, the uncover component of the test will show no movement as there is no misalignment of the eyes. On this orthophoric patient, there is no movement of the right eye when it is uncovered. There is also no movement of the left eye when it is uncovered. Here we see the uncover component performed on a patient with a manifest deviation or tropia. When the right eye is covered, the left eye is forced to take up fixation by moving outwards. Due to Hering's law of innervation, when the eye with the manifest deviation takes up fixation, the other eye will also make a conjugate movement in the same direction. This means that under the cover, the right eye will move in. Therefore, when the cover is removed, we will see a movement of the right eye outwards. What we are observing here is not aphoria, but a conjugate movement in response to the left eye moving back inwards to resume its usual esotropic state. The left eye makes no movement when it is uncovered as there is no underlying latent component. This patient has a latent deviation that can be classified as an exophoria. This means that the eye will drift outwards under the cover. Therefore, when the cover is removed in the uncover component of the cover test, we see an inward movement of the eye to regain fixation. Here we see the right eye move in when it is uncovered. When the left eye is uncovered, it also moves inwards. The alternate component of the cover test detects both the manifest and latent components together, therefore giving the maximum deviation size. It involves switching the occluder between the two eyes, preventing the patient from being binocular. The alternate cover test does not distinguish between manifest and latent deviations. If you are not detecting any movement on the cover-uncover component, the alternate can be used to increase dissociation, which will bring out well-controlled or micro-deviations. A patient with no deviation shows no movement on both the cover and uncover component, as well as the alternate component, as they have no misalignment of the eyes. A patient who has a manifest deviation will show their maximum deviation size on the alternate component of the cover test. In this case, we see both eyes make outward conjugate movements due to the presence of an esotropia. Once again, the use of the alternate component of the cover test acts to elicit this patient's maximum deviation size. In this case, we see both eyes making conjugate inward movements due to the presence of an exophoria. Now we will observe all three components of the cover test being performed on a patient at near using an accommodative target.
Today we're going to be doing a cover test, so I'll be covering and uncovering your eye with this occluder here so we can determine how well your eyes are working together. Okay, so we'll just start off by having a look at this target here. So what's the lowest line you can read?
HOVTV.
Okay, cool. So can I get you having a look at that O for me?
Alright, so keeping your eyes on there. Good, still looking at that O.
Yep.
The recording for a cover test should include whether the test was performed with or without correction, the distance at which the test was performed, the deviation type found and its size. If the deviation is manifest, the eye which has the deviation must be recorded, as well as the fixation pattern of this deviation. It may be holding, not holding, or alternating in fixation. If the deviation is latent, the recovery rate must be recorded. It may either be slow, moderate, or fast. This recording shows a cover test was performed without correction at a near distance of 1/3 of a metre. The symbol used represents orthophoria and tells us that there was no horizontal or vertical deviation detected on the cover test and that the patient's eyes are straight. This recording shows a cover test was performed without correction at a near distance of 1/3 of a metre. The results show that a moderate left esotropia was found, not holding fixation. This recording once again shows a cover test performed without correction at near. The results show a small exophoria with rapid recovery. The cover test has a number of pros and cons. Its advantages are that it is quick and easy to use, it is portable and requires no specialist equipment, and it is the gold standard for detecting and diagnosing strabismus. In terms of its disadvantages, the alternate component of the cover test cannot distinguish between manifest and latent components. When performing the cover test, there may be instances in which a deviation is present but no movement may be seen. There are a number of factors that may cause this, and it is important to be aware of these. Firstly, if a patient has very poor visual acuity or dense amblyopia, they may not make a movement to take up fixation as the vision in this eye is too greatly reduced. Also, if a patient has eccentric fixation, they will not make a movement to take up fixation as they are essentially already fixing using this new eccentric point. Mechanical restrictions could also be a possible cause of an eye not being able to take up fixation, as the restriction may physically limit the eye from making such a movement. The cover test, whilst primarily used to determine the presence and type of strabismus in primary position, can also be used in the 9 positions of gaze to test for any over or under actions of the extraocular muscles, or in conjunction with prisms to measure the size of a deviation using what's known as a prism cover test. That brings us to the conclusion of this video. Thank you for watching.